Welcome to Lessons in Leadership. I'm Steve Adubato. You can see it right there. With the lovely and talented, my colleague Mary Gamma. How you doing?
I'm doing great, thank you. Especially when you introduce me like that, it's a good day.
Well, that's because your review is coming up and I wasn't going to give you the money you expected. That being said, I'm Steve Adubato. This is in Lessons in Leadership. Look at all these wonderful, this is part of our leadership library, a whole range of books beyond my book, Lessons in Leadership. There are other great books here. We'll be plugging them throughout the series. Before I introduce the very lovely and talented and outspoken young lady we have on this edition of Lessons in Leadership, Michele Adubato, the CEO of the North Ward Center, and my older sister. I'm joking. So she's
you sure are
the same
joking.
age. We're twins. So, Mary, tell folks where they can find us.
Absolutely. They can find us on our website, stand-deliver.com. Also on Facebook, Steve Adubato, PhD. That's Adubato.
What about the whole Apple Podcast and the Google Play thing?
I was going to get there in just a moment, but thank you. And they could actually subscribe to us on Apple Podcast and on Google Play.
But there's more than that. We're also being found these days on the AM 970. Those are our partners in New York at the great radio station in Lower Manhattan on Wall Street. Find us on their website, AM 970, plus FiOS On Demand, ROINJ, as well as New Jersey Business and Industry Association site and other places. We're going to be all over soon. That being said, Mary, let's also thank, by the way, Michele, we don't actually talk to you. We just thank all kinds of people like our funders. You know about fundraising, right?
I do.
And you have to thank your funders.
All the time.
And our funders are?
They are New Jersey Resources and Prager Metis. We thank them very much.
Prager Metis, one of the great accounting firms.
They sure are, absolutely. And RWJ Barnabas Health, we would like to thank them as well.
Great stuff. So let me introduce on Lessons in Leadership my talented and very outspoken and strong younger sister, Michele Adubato, who is the CEO of the North Ward Center. How you doing?
Good, very good.
You like
and
this?
I'm going to get in big trouble if I don't say also the founder of the Center for Autism.
Nice.
Yeah.
Very good. Thank you very much. And I would get in trouble if I didn't say we were at East Main Media Studios. Brian, right?
Yes, thank you.
And
Part
can
of
we
it.
plug a website as well for the Center for Autism? Would you like to do that?
www.centerforautism.org
And the
Can't
North
get
Ward
easier than that.
Centers?
is northwardcenter.org.
Wow, that's really a lot. You
So I have people for that.
Yeah. Let's get right into this.
I love it.
Have you always...
I can't remember. You can't either, so
Listen,
I don't remember anything.
Here's my question. People, your people.
People.
Are they your people, right? Meaning you want to mold them into what you believe they need to be the best team, because, by the way, that's what Lessons in Leadership is all about, is learning. Are they, because you are highly intense as I am, have ridiculously high standards, do not suffer fools lightly, and are impatient? I wonder where we got that from.
Certainly our dad.
Yes, Steve Sr., who is the founder of the North Ward Center. In all seriousness, do you find that it's challenging being as high-powered, type A, high standards, no BS, no excuses, and that's all meant to be a compliment in all seriousness, and others who don't live that way?
Yeah, it sure is. Because, you know, what happens is you have to be your best self at all times, meaning you, who you are as a leader. And, you know, the problem is that you also have to find where people belong.
What does that mean?
You have to find where they fit.
Jim
And
Collins, a
you-
book right in front of you,
Absolutely.
he talks about putting the right people in the right seats
Very important.
on the bus. Go ahead.
Very important. Because someone could be very talented in a certain area, but if they don't fit what you need them to do, it's not going to work. So I think I've evolved, hopefully, as a leader.
From what to what?
Well, intense is a good word. I think I still am intense. But I do take a moment.
I'm going with passionate. You're passionate.
I do take a moment now to say the people that I have around me are trying their hardest. Because sometimes I think we would all be like, you know, you're just not doing enough. Why can't you do this? And it's like, first you have to come from a place of these are really good people who are really trying to do their best. Now, my role then, I think my role has changed because coming from like a micromanager.
By the way, describe your background before you came into the CEO position of the North Ward Center, celebrating its 50th anniversary, which is a big year. 2020?
2020.
This will be heard and seen in
That's
2020.
amazing.
That's amazing.
That is amazing.
Right?
It's a beautiful thing.
Yeah.
Before you came back to the organization, our dad started 50 years ago.
Right.
You were a leader where?
So I was a principal for a long time at New Jersey Regional Day School. I spent about 25 years in Newark Public School System. That gets you ready. That certainly gets you ready. Because you're dealing with, I think, a group of people that we want to do the right thing, but maybe they're Knowledge base is definitely mixed, and you have to try to do your best with what you have.
You don't get to move people onto the right seats on the bus as easily?
Exactly. And that's really part of, I think, where the evolution of, for me, after spending a couple of decades at Newark Public Schools, which again, tough place, it's challenging what we're doing, but you have to have that passion. And sometimes, I think in every field probably, maybe people stay a bit too long and you don't have the ability to just kind of maneuver. And that's like a huge thing that you need to do, which where I am now at the North Ward Center is, my ability to do that.
By the way, sorry for interrupting. Describe the North Ward Center for those who don't know. And also go on the website. It's northwardcenter.org.
Right.
Not .com. It's a not-for-profit.
Yes.
All right. So what they go
because you had that written down somewhere.
No, and I just know.
He actually doesn't have it written down.
Okay.
No, because Daddy would be not happy if we didn't know the website, which you didn't and I did, but that's okay.
But I think it's important for people to know, what is the North Ward Center?
So the North Ward Center, again, has been around for 50 years, and it's a multi-service nonprofit. Started out with preschool, started out with youth leadership development. We have over 700 preschoolers, Abbott Preschool. We have a private preschool. We have the largest youth leadership development program in the city of Newark. We have Casa Israel, adult medical day programming. We have family services. My father also founded Robert Treat Academy.
A charter school.
Blue Ribbon charter school.
Recognized nationally.
Absolutely. So there's an array of services there.
So, it's interesting. By the way, if you want to find out more about Michele and I making reference to our father, Steve Adubato Sr., you should Google Steve Adubato Sr. A lot of interesting things will come up.
Yeah.
But I write a lot about our father in my book, Lessons in Leadership. That's where the name of this show came from. And there's a lot of very candid stuff about his leadership style, which I'll give you the opportunity to describe. Because I often do this with Mary, and I think she thinks I'm exaggerating or engaging in hyperbole. Describe the leadership style of our dad, both at home.
Is that a style? Would you consider that a style?
Okay, what would you call?
I don't think you can put it in a book.
Well, I did put it in a book.
You put it like for a couple of pages and you glossed over it because it's not a style.
Okay, what did we learn about life and leadership growing up, which has
the
influenced who
biggest
you are as a
thing-
leader today?
Absolutely, but it also influenced me on things that I shouldn't do.
I said that in the book. Go ahead.
So I think the biggest takeaway we can take from our dad in terms of leadership is at high standards. Like, definitely, it has to be the best. Good isn't good enough. How do you get good to great? And that's really the challenge. The passion, the mission, the focus. I think the things that...
How about the yelling?
The yelling doesn't help.
Tell us more.
So I think what I learned from my dad in terms of leadership, again, the good things are, again, the passion and the focus and the mission-driven
and the vision,
purpose.
too. Having a vision nobody else even sees, much less buys into.
And that's what I call the curse. I have the curse of vision.
Why is it a curse? It's a good thing as a leader.
Sometimes you see things before it happens, and it's almost unfair to the people around you because I start in mid-sentences, and they're like, what? I'm like, okay, now we're going to go here. And they're like, wait a minute, we just finished this, Michele, and you want us to pivot that? And I'm like, yeah, we're moving.
Hold on a second. I call that connecting the dots. Mary's like, what dots here? Mary connects the dots, and she sees dots I don't see. You pick up what she's talking about?
Oh, absolutely.
Is it why Michele says it's a curse. By the way, you're listening to or watching Lessons in Leadership, Steve Adubato with Mary Gamba, our co-host and executive producer, and also Michele Adubato, the CEO of the North Ward Center, celebrating its 50th anniversary, and also the head of the Center for Autism. She says it's a curse.
It is a curse. Any great visionary, any great leader, and I understand completely what you're saying, once you have that great, grandiose idea, then you have to get people to follow and you have to get people to believe in it and buy into it and get it done. And the hardest thing is getting the right people on board to get that done for you and to see it from your perspective as well.
Will
the
they
other
ever?
thing is, and that's the key, Mary, because if it's just your vision and you can't share it, and I think that was kind of like where my father lacked.
Don't you see it?
And what happens is when you have somebody like that is so overbearing and overpowerful, is that sometimes the people around just will shut down.
Right.
And that's what I don't want. I'll be in meetings and I'm like, I do question myself and say, why am I the only one talking right now? Are you not hearing me? Is it not connecting? So I do a lot of self-reflection.
Yeah.
So I can say I make mistakes, as we all do. The evolution of leadership is about, for me, is to really spend more time with my leaders and for them to share that vision. So because as you get more and more employees, the problem is, are you still connecting?
Are you a micromanager?
Absolutely. But I've tried to really walk away from that in terms of micromanaging. And what I've realized is you can't be after a certain point.
I call it strategic micromanaging. Pick your spots.
Yeah, but you know, if you do that all the time, you're either going to wind up in the hospital,
Yeah.
you're going to have the high blood pressure through the roof, and no one will continue the vision because it's much more than myself.
You backed off.
And then people won't believe in
Well,
themselves. If you're constantly right there, it's almost like raising a child. If you're constantly, and Steve and I
absolutely.
talk about this a lot,
Yeah.
if you're there to save them all the time, if you're there to tell them how to do something half of the time before they've even begun it, it definitely causes them to question their own ability to get things
Absolutely.
done on their own.
Yeah.
By the way, Michelle's talking about self-reflection. And again, these books are not simply props. This book by Dr.
Yeah.
Daniel Goleman, I'm a big fan of because he coined the phrase, quote unquote, emotional intelligence. And I talk about him a lot because emotional intelligence to me is a lot of things, but the one thing I know it is knowing yourself and being very self-reflective and questioning. People, why always questioning yourself? Well, it's because I'm not sure. I love people who are sure about everything. They scare me. But Goleman talks a lot about that. And when you come from, and that's really where my question is, when you come from a legacy or you take over an organization where there's a strong legacy, and by the way, we do in our book, Lessons in Leadership, there's a lot about succession planning. And let's just say succession planning in our family with my father running the Northward Center was, he was never going to stop running the Northward Center.
Exactly.
That was his succession
the plan.
I'll be here forever.
Yeah.
Well, what about if we, I remember like 20 years ago, they started,
Yeah.
he's 87 on Christmas Eve. Like 20 years ago, they started this conversation. He looked around like, who's starting this conversation? Like,
Right.
there must be a coup against me. Meaning, succession planning was not, you came in to help an organization that needed your help. My point is this. Is it any more difficult to be a strong leader in an organization where there's such a strong legacy of your father
Yes.
as the CEO, not just your uncle or your cousin
Right.
or a distant relative? Go ahead.
Absolutely. But I came in with a lot of tools. I came in as the founder of the Center for Autism. I came in with an excellent reputation of managing and leading. I think if I came in kind of like, you know, I've never done this before.
Or the kid that didn't have a job and that kid.
You know, the daughter, like,
Mary and I
that
watch
would be-
Succession.
would be
You
a
don't watch
problem.
Succession,
That would
do
be-
you?
No, I don't.
It's
Yeah.
like, who's going to take over the family business?
Exactly.
And one's a total goofball.
Right, right.
But the point is,
Everything else fails, so like, let me do this.
But Michelle,
you try it
Michelle
all,
had the
and then-
track record coming
Yeah,
in.
I had a track record. And
Do you often think, what would Steve Sr. do?
I do. And I often say to myself, I think he would be really proud of that.
I know he would.
But I often say also, that's not something my dad would do. But that being said, I am spending a lot of time on what's going to happen after me.
Let's stay with this. And by the way, can we thank our funders again at New Jersey Resources, Prager Metis, the accounting firm, and also RWJ Barnabas Health, and a whole range of others.
And
Check
for
out
people
our.
on the radio, we'll remind, we're talking to Michele Adubato.
Well, this is Michele Adubato, the CEO of the Northward Center, celebrating its 50th anniversary in 2020. Go on our website, by the way, at stand-deliver.com to check out more. But Michele, let me jump right back into this. We have you for a couple more minutes. We ask leaders who happen to be women this question all the time, so I'm going to ask you. Leadership, strong leadership, effective leadership for a woman, any different than for a man? If so, how?
I think we have to prove ourselves more. We have to make sure we're always on. Don't take it personal, but I think we're better managers of things in terms of doing more than one thing at a time.
Get out of here. Stop.
Multitasking.
I think I just had this conversation with one of my leaders this morning.
Stop. Seriously?
Absolutely.
Women are
We
better
are-
multitaskers than men. Make the case.
Absolutely.
You can't just
Absolutely.
make these statements.
I've seen it over and over again. Men, you need to help. Like, okay, we're going to do this today, and this is what else is going to happen, and now we're going to do this. And I see my leaders who happen to be women go, okay, let's go. And I'm like, okay, let's work with him. He needs some help.
Mary, you buy this multitask? By the way, Mary's the quintessential
well, look at who
multitasker.
we are. We're mothers, we're
Right.
aunts, we're neighbors,
taking care of parents.
we're
Yeah.
bosses, we're
Yep.
we're taking care of parents, we're daughters. I mean, we do a lot of things at once.
You buy that, Mary?
Exactly. I buy it full-heartedly.
And then watch football on Sunday.
Exactly.
Mary's watching hockey, trust me.
I always go back to every Christmas. My husband is just as excited about what the kids are opening as the kids are because he had no part in planning it, no part. He's like, that's great.
We got that.
And we both work full-time, so it's not like I'm home and have all this time to get everything.
But you're responsible for that.
Oh, gosh, yeah.
It's so interesting. Women do multitask.
Yes.
Yeah.
Leading a not-for-profit. As we're taping today, we got some top-level executives within the university world.
Right.
Also, our chief counsel at WNET, Bob Feinberg's coming in, who also founded the Montclair Film Festival. Just all kinds of different people. But a lot of the folks we interview are in the for-profit sector. Mm-hmm. You're in the not-for-profit sector. Mm-hmm. Leadership in the not-for-profit sector versus, hey, bottom line, got to make money, business world. Any different?
Well, in this climate that we're in, you better start looking at your finances and understanding where all your funding stream is. So I wouldn't say it may be different in certain contexts. Absolutely. I mean, it's not easy to compete out there, as we've seen, like many nonprofits. I've heard so where did this go? Oh, we had a grant one year, we don't have a grant. That's not the way the Northward Center works. So we are in, as we say, the business of social service. And that's certainly from our dad.
Business.
Absolutely.
And what would he say about a program that wasn't either bringing in money or was failing financially? What would he say?
Don't do it. Not for us. And I do have that same philosophy of if this does not help us to sustain our central office or whatever we need to do, it's probably a wonderful thing. It's just not for us. Hence the 50 years of the Northward Center going strong.
By the way, what's the celebration going to be like?
Oh, it's going to be a year-long celebration.
Steve Sr. loves celebrations. He loves big things.
Yeah, it's gonna be big.
A lot of people.
Yeah. Almost every month we have something else going on because that's what it's going to take. You know, we thought about one big event. We certainly are going to have that. But it's like going down to the city hall, going down to, county freeholders, going to all the different places that have been a part of who we are. And so every month we have something planned.
Real quick, before I let you go, the Center for Autism, describe it and why it matters personally and professionally to you.
First of all, running a nonprofit has always been, my heart, who I am. The Center for Autism is a culmination of everything about my profession and what I expect to do for people and what we need to do for our community. Because unfortunately, in Newark, there are no services, little to no services for people with autism and their family. And literally, if we were not there, if we were not the foundation, there would be nothing there. But not only are we there, they're very aware of us, and we're such a huge part of this community. And that community is part of who I am. I can say that people with autism have taught me more about human nature than any other person, even with, I would put my dad in that, because they've taught me about humanity. And they've taught me about integrity.
You've been listening to Michele Adubato, and the person who clearly has taught her the most is sitting right here. It's, no, I'm joking.
Oh, thanks, Steve. It's me.
Hey, stop fooling around. This is a serious podcast, video cast, could be heard, could be seen, and that's why we have the best leaders from anywhere in the tri-state area. Michele Adubato, my little sister doing big things, the CEO of the Northward Center, also the founder, the head of the person who created the Center for Autism. Celebrating 50th anniversaries at the Northward Center, an organization our dad founded in 1970 as a school teacher in Newark, making less than no money. Trust me, we were the kids we knew. And he created this organization because he had a dream and he wanted to help other people. You've done well. I'm proud of you. We're all proud of you.
Thank you.
Dad would be proud of you. By the way, we never could teach him anything about leadership. He wouldn't listen. But that being said, this has been Lessons in Leadership. We'll take a quick break. I want to thank our funders again at RWJ Barnabas Health, Prager Metis, the accounting firm, New Jersey Resources, a terrific energy company down at the Jersey Shore. I'm Steve Adubato. That's Mary Gamba. This is Michele Adubato, and we'll be right back.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
This edition of Lessons in Leadership is brought to you by New Jersey Resources and Prager Metis, your world worth more. Welcome back to Lessons in Leadership. I'm Steve Adubato and my trusted colleague, Mary Gamba. We were just listening to Michele Adubato, the CEO of the Northward Center, the founder of the Center for Autism. Your biggest takeaways?
Just really knowing the people on your team is a big part of leadership. Michele talked a lot about She can't do it on her own, even though she would like to. We would all like to, right? We talk about you and I being micromanagers. If you want something right, do it yourself. But you cannot be an effective leader if you're going to rely on doing it all yourself.
These couple other things that she mentioned. And again, I don't want to obsess over this whole thing of the fact that our dad was the founder of the North Ward Center and we learned leadership and about life from him, the things that were effective in our view and also the things that weren't not particularly effective. But I'm curious about this because we talk so much about that because our dad was such a public person and founded these organizations, was also a leader in the teachers union in Newark, New Jersey, where we grew up. To what degree do you feel you've learned about leadership from your family? P.S. Do you separate leadership from life?
Oh, those are two really powerful questions. So
That's what I do.
I know, you do it well. As far as my family, and you and I have talked about this before, we were sharing before about Little House on the Prairie. My upbringing was very much the opposite of what you just talked about with your sister, Michele.
I joked in that show and called it, we lived in the dysfunctional house in Newark, New Jersey. Go ahead.
And you and Michele had described how your dad had raised you.
It was volatile and crazy and dysfunctional and angry and no one listened.
There was no yelling in my family growing up. There was zero yelling, almost to a fault. And my parents will say that today because then when I did get out into the real world and things maybe didn't go the way that they were supposed to, there wasn't somebody there to say, it's going to be okay. Sometimes it's not as collegial as that if you do something wrong, whether at work or at school and just in life, frankly. So on the one hand, it was great because it taught me to be very empathetic and understanding, but it was a great upbringing in terms of just overall knowing how to be sensitive toward others' feelings.
Empathy.
Yes, but thick skin, it did not give me a thick skin.
Because that's why I want to talk about this. Again, these books, not a prop if you're actually watching us on video on Lessons in Leadership with Steve and Mary, but Crucial Conversations, Tools for Talking When the Stakes Are High. This is a wonderful book, New York Times bestseller. It's on our leadership library, which is on our website at stand-deliver.com. Why do I mention this? Because I know we've talked about it before, but Michele and I talk about this a lot. We were raised, and it does have to do with leadership style, to confront everything, virtually all the time. Translation. Crucial and difficult conversations that a lot of people avoid because it makes them uncomfortable. Colin Powell told me, as you know in the book, one of the great chapters is called Sometimes Great Leaders.
Yeah, piss people off.
And sometimes it's because of these conversations. There's a question here, trust me. Did you have to learn to have, quote, crucial/difficult, uncomfortable conversations? You have to, as a leader, did you have to learn that?
I had to learn how to have those conversations with others, but first I needed to learn how to receive those conversations. When someone was giving me that feedback, when somebody was saying that something that I did really wasn't as good, well, I tried really hard, and we often hear that. And for me, it was a learned skill. I learned by reading. I learned by Googling, okay, how do I handle this conversation? Just last week, I had to Google how to handle a situation. Because
did you really?
I really did.
Was that the one we had at work or another one?
No, it was totally another one. But
it was all about me.
It was, no, I don't want to bring family into it, but it was literally just how to deal when your son is disappointed after a game or after because they weren't played or,
we've been there.
You know, because you think you're doing the right thing at work and leading others. And sometimes is it to say something? Is it to not say something? Is it, do you feel sorry for them? Do you empathize with them? Because you don't really know what it's like to be in their shoes. So I did a lot of reading growing up and into adulthood in terms of having those conversations. And more importantly, the consequences of not having those conversations for me was eye-opening, because if you don't have those conversations that are so hard, nothing's going to change.
And by the way, I was mentioning this before, if you're watching us on the video side, this baseball, which isn't just a regular baseball, it is a Little League baseball, and it is signed by a bunch of kids.
Oh,
You're wondering,
I didn't know
this is fun, right?
Yeah.
So last time I coached our son's not travel team because the stakes would be too high.
Yeah.
It was the rec team, and I remember, and all the kids signed it. And I remember, you talk about, you know, a game doesn't turn out well, or Mary and I have teenage boys, and we also have our daughter Olivia, who's 9. Those conversations have to take place because we are the parent. Mm-hmm. We have to have them. They're difficult, and with our kids, sometimes it's not doing well in school, whatever. But here's what I'm going to. You and I had a conversation recently. It was a crucial and important conversation that we actually had talked about beforehand with a particular team member. And this could happen any organization, anywhere. It could be any one of our team members. And I remember you and I were talking about it, and we said beforehand, what's our goal? Let's play this out. And by the way, one of the great things about this book, Crucial Conversation Tools, which I use in our seminars in leadership, is that there are some things you can do, and one of them before it is to determine what exactly is your goal. Well, we just have the conversation, just be honest, put it out there. Well, what's your goal? To be honest and put it out there? You want to get to a certain place. How important is it to know going in, A, what your goal is, and B, if it's veering off? Am I over analyzing this?
Not at all. Not at all. And in any situation, you need to, first of all, understand what the problem is, right? You need to say, this is exactly what, as we see it.
Which may not be as the other person sees it. Go ahead.
Exactly. And then, as you said, come up with a goal. All right, at the end of this conversation, what I hope is this person is going to make sure to meet that deadline without me reminding him or her to meet the deadline, just using an example. But you also need to anticipate the pushback, the questions, the defensiveness, because human nature, everyone's going to get very defensive.
So don't assume in great leadership and communication, I'm going to say what I need to say, and the other person is going to be very receptive, and it's going to work out well. That would be nice, but that's not a strategy.
No, that is not a strategy at all. And if anything, some people are actually really good at arguing, so you may start second guessing yourself, and you don't want to sit there humming and trying to figure out and be like, ooh, I never thought of it that way, or maybe they're right. And not that you need to be rigid, because that's not a good leadership style either, but you do need to have a roadmap going into the conversation of the if-then, where am I going to go with this? And then most importantly, at the end of that conversation, what are you going to agree to, both of you, to do next?
And we put this in writing.
Yes.
Why?
If you don't put it in writing, number one, time's going to pass and you're going to forget what happened. And then 3 months down the line, if a similar situation happens and you say, remember a few months ago we were talking about this? I don't remember that. You have it in writing. So it's not to play gotcha, but oftentimes it's to help me to remember, was it as bad as I thought it was? Is it really just because I don't really particularly enjoy being with that person? Is it the thing or is it the person? So you need to really analyze as a leader, is it the personality, is it the person, or is it the problem at hand?
You know, I'm going to say something that I'm not even sure I'm supposed to be saying on the air on Lessons in Leadership. Again, thank our friends, otherwise known as the people who sponsor what we're doing at Prager Metis, New Jersey Resources, RWJ Barnabas Health, also the folks at Valley and the folks at Gibbons, PC, Local 825 operating engineers, et cetera, et cetera. So let's do this. You said to me recently, and again, I don't even have the clearance to talk about this on the air. So
I always get so nervous when you do this, but go ahead.
You said, in no uncertain terms, your, quote, attitude and level of patience with excuse making, finger pointing. I'm holding up the book. Mary, tell everyone what I'm holding up.
Extreme Ownership.
Which is, in fact, written by 2 Navy SEALs who said no excuses, no blame, no finger pointing. You said to me, Steve, maybe it's age, which clearly is not your case because you're so young. You said, no, I'm not doing it anymore. I'm not going to listen as long as I always have in the past.
Yeah.
What's going on with you?
That's a great question.
But don't think that I ignore when you said that. It struck me. Go ahead.
No, and this is actually a great thing to talk about because I'm challenged, and if anyone's listening and they want to just chime in and send an email, they can do so.
How can they do that?
I'll even give out my personal email right here because it's probably the quickest way to get to me. It's marygamba@aol.com. Shoot me an email because I would love some advice on this one.
Mary's home address is?
Yes. My height and weight.
Go ahead.
And so we were talking about this because I feel like I have zero empathy.
Your empathy, hold on, you just started this show talking, wait a minute.
I said I learned it.
Go back and learn what Mary said about her family, taught her about empathy. Go ahead.
It did. I learned it, and now it's done a complete 180. I have almost, I would say, zero empathy at this point in my life. And you could ask my husband, you can ask the kids. It's bad. But on the flip side, as a leader, it helps you to confront things in a much more effective way if you can go in and take out the emotion out of it. So in the situation that you and I were talking about.
Which anyone out there is listening or watching us, it's an employee who in a particular situation may not meet the level of performance that is expected because that is what is expected to be great, as Jim Collins in his book, Good to Great says, the performance, it's an issue.
And it could be, exactly, and anyone listening
could be an incident.
It could be anything.
Go ahead.
But taking empathy out of the equation helps you to be, and I don't want to say cold-hearted, but it helps you to see the issue at hand. It helps you to realize the consequences of not addressing that issue. So for me, it was really just a matter of, I don't know if it's age or what, but I have less of an issue confronting problems because if you don't, the behavior is not going to change. And then you could teach others. We were talking before with your sister, Michele.
Michele, check out the
Adubato.
earlier version. It's Michele Adubato, the CEO of the North Ward Center.
Yep,
Go ahead.
absolutely. And we were talking to her just really about succession planning. And my goal, again, and as we all are getting older, is to really just help those that are newer to working with us grow within the organization. So when the time comes and the sun sets, then there's a whole other tribe of people there that can really help us out and keep that organization moving
Is
forward.
that our job?
It is. And I think that across the board, you can name any organization, healthcare, banking, anything, finance, any type of business, you need to be training and coaching and mentoring. So this way the next group can then take over where you left off.
Let's do this. About 2 minutes left in this program. One of the things I want to touch on, and we will talk about it in a later program in more depth, but I am curious about this. This book is simply called Blind Spots. If you're looking on camera, you can see this. Blind spots. I'm going to open up the Pandora's box. You know where that comes from?
The term blind spot?
You know what it's in reference to?
Is it the horses?
So blind spots, Mary and I do this thing. We ask our clients, we do leadership seminars, we do executive coaching, et cetera, et cetera. And one of the things I ask people to do is the hub and spokes model. Would you describe what it is?
Yeah, the hub and spoke. So really, if you are in business, again, any type of building relationships, you put yourself at the center.
You're
in
the hub. It's a circle.
You're the hub.
Draw a
It's
circle for yourself.
Okay.
If you're watching or listening, draw a circle. I'm doing it right now. I'm putting Steve in the circle. Now, what are the spokes?
And then the spokes are almost like on a tire where you have the metal bar, the bicycle tire, the metal bars coming out, and then there's little bubbles on the side. In those little bubbles, you could fill in whether it's your board members, whether it's your clients, your customers. It could be the media, depending
your family.
It could be your family.
Who are they? Stakeholders?
Stakeholders, anybody that matters in your life, anybody that either makes you a better person, brings in business, if they are there to support you. It could be your attorney, it could be your accountant. It's people in your orbit that you need to make sure that you're constantly connecting with on a regular basis to keep everything moving forward.
Including every person on your team.
Definitely.
And that being said, the reason why blind spots got my attention, and again, it'll be in our leadership library in the last minute we have on lessons in leadership, it's that I'm very focused on blind spots. And if you're not looking for where you're clouded or you don't see who you need to be dealing with, who you may not have connected with, who on your team you're losing track of, who in your orbit is not feeling the love, all of a sudden it's the last minute, late in the fourth quarter, and you're like, what do I do to fix this? And this whole concept of blind spots, and again, we'll talk about it in greater detail in another edition of Lessons in Leadership, really helps us stay on track.
Yeah, no,
That's
absolutely.
it. That's all I got. That's another edition of Lessons in Leadership, funded by...
It is funded by our friends at New Jersey Resources, Prager Metis, RWJ Barnabas Health, and many more.
Valley Bank, as well as Local Aid 25, the operating engineers, so many others. I'm Steve Adubato. That is Mary Gamba. By the way, folks, go on our website. What is it again?
stand-deliver.com, and they can follow us on Facebook at Steve Adubato, PhD. That's Adubato.
Thank you, folks. Steve and Mary, Lessons in Leadership. Catch you next time.
This is Mary Gamba. Stay tuned. We'll be right back with State of Affairs with Steve Adubato, where we look at the most pressing issues facing the state of New Jersey.
This edition of Lessons in Leadership is brought to you by New Jersey Resources and Prager Metis, your world worth more.
Funding for this edition of State of Affairs with Steve Adubato has been provided by PSE&G, committed to providing safe, reliable energy now and in the future. The law firm of Gibbons, P.C., MD Advantage Insurance Company of New Jersey, Wells Fargo, Johnson & Johnson, NJM Insurance Group, Community Food Bank of New Jersey, Fedway Associates, and by ADP, a comprehensive provider of human resources technology and services. Promotional support provided by NJ Advance Media and by Tap Into TV.
I'm Steve Adubato. This is State of Affairs coming to you from the NJEA TV studio in Newark. It is our honor to introduce Dr. Shereef Elnahal, President and CEO of University Hospital. Good to see you.
Thanks for having me, Steve.
The former Commissioner of Health in the state. How different is this job?
It's different, but there's a lot of the same focus on public health issues. One way that it's different is that I'm actually running an organization that has such an important, storied history here in Newark. the hospital really promised tremendous things to the community here. There's a history of displaced communities, broken promises, particularly to the African American community here in Newark. The hospital was part of that bargain after the Newark Accords to do something about that. And so there's a lot more community work that I do to help fulfill that promise. But I'm also focused on a lot of public health issues that I was focused on as commissioner.
Top two?
I would say the HIV/AIDS epidemic in Newark is top of mind, and also just chronic disease and how much that's affecting residents throughout Newark.
You've also talked a lot about the opioid crisis. You've written about it.
I have.
You said we need to do more. Be more specific.
So hospitals in particular have an important role to play, and my involvement in this started when I was in the state. Governor Murphy really pushed us to do everything we can for the epidemic. And so one of the initiatives was reducing overprescribing of opioids. We took best practices from across the state and tried to scale them. That is a funded program now. University Hospital has its own version of that program called STOMP. Stomp out opioids and treat addiction. So what we're doing is having every single pathway possible for our emergency room physicians to prescribe things besides opioids and connecting our patients to as many alternative treatments for pain as possible. The goal is not only to avoid opioids, but to be successful in treating pain, because if you're not successful, somebody's going to go elsewhere just to get opioids. So we've had some great success with that, 70% reduction over just a few years in opioid prescribing.
Give me another topic that you care deeply about.
I really care about doing a lot more for population health in Newark.
You know, the term population health is thrown around a lot. Define it.
It is going above and beyond outside the traditional walls of the healthcare system to do what you need to do to make patients better. If that means doing things like helping them replace their carpet, which is causing their child to go to the emergency room for asthma, with tile, or if that means taking a homeless person and housing them, that is what population health is about, because the root causes that make people come to the hospital are very far upstream in terms of the difficulties they face in life. And unless we start to address those issues in Newark, we're really not going to make progress for our hospital.
So it's interesting, you know, you have a short-term, medium-term, excuse me, and a long-term plan. Are these the kinds of issues that are at the top of the agenda for you as the leader at university?
Absolutely, and we really have to be thinking in all three time phases. There are a lot of short-term problems that we have to address at University Hospital. I'm optimistic because the staff is from the community. They have the skills, they have the talent, they haven't had supportive leadership at my level to encourage them to do better. So we're talking about improvements in quality, we're talking about improvements financially to sustain the hospital, and we have to make sure we maintain regulatory compliance. I'm focused on those three things.
Where does vaping fit into this?
Unfortunately, hospitals across the state are seeing more and more vaping-related illness. We always knew that vaping was risky, but in recent months and years, there's been the addition of chemicals that are involved in flavoring, and most recently, the CDC identified a chemical called vitamin E acetate.
Vitamin E acetate, go ahead.
That seems to be the root cause of so many young people having to go to the emergency room and be admitted to the hospital for severe lung illness from vaping. So we've seen our fair share of people with vaping-related problems, and it's a public health issue that we really need to address head-on.
I'm curious about this. Because you have a clinical background, right? Are you able to talk to your fellow clinicians in a different way?
It helps. I would say it's not necessary to be a leader in public health or in a hospital, but you're able to relate on a different plane, especially with the physicians and the clinicians, the nurses, because of personal experience that I've had seeing patients. So it definitely helps.
Curious about this. University Hospital has a long history. We should also disclose in the past, the university has been a supporter of the programming, excuse me, health-related programming we're involved in. But curious about this. Because university has been under a microscope for a long time on the state end. By the way, explain the connection between the state and University Hospital.
So University Hospital is something called an instrumentality of the state. It's an instrumentality. It's the only...
No jargon here.
Only kind of thing that's called an instrumentality. We are part of the state, but we are independently responsible for our financial future. So we have to make sure we support the hospital with our operations, the way we treat patients and volume of patients that we see. We do get support from the state, of course, for charity care. We have the highest charity care population.
Explain to folks who don't know what charity care is and why it matters.
And it really matters these days because more and more people actually are losing health insurance in the context of what's happening in Washington. So anyone without health insurance, including Medicaid, can potentially qualify for charity care, where the state ends up subsidizing your care a couple of years later. We have to file those claims with the state, so the state supports.
Because no one can get turned
care.
away from the emergency room, correct?
We have a mission at University Hospital that we never turn anybody away, regardless of ability to pay, regardless of documentation status in the United States. We are there for everybody. And that's why we have the largest percentage of patients in the entire state who are charity care patients.
But in that context, where I was going with the bigger picture question is this: how challenging is it for you and your team at university to deal with reputation? Meaning, if someone reads certain media reports, a certain hospital scores a certain way on a particular grading system, and there's so many out there, but their perception is that university is an urban hospital, trauma hospital. I don't want to get into a branding question, but how much of it is not just what you do, but how you present what you do to the larger community?
It's a really important role that I have, Steve. So the different metrics and the different grading systems don't necessarily capture what University Hospital does.
Methodology is a funny thing.
It is. We are the level 1 trauma center for the region.
Explain that.
We take the most severe trauma in the region, and that comes to our hospital. We have the expertise, we have the surgeons, we have the infrastructure to be able to treat the most severe injury, whether it's a car accident or an episode of violence in the city. We are there for the city. We are also the main academic medical center for Rutgers, New Jersey Medical School. And so we have some of the top-notch academic physicians in the entire country doing research and treating patients for complex conditions. So these are the things that are often missed if you just sort of focus on some of the public grading systems that don't necessarily reflect our safety net mission for the community here, but also our academic mission.
I've asked you this before, I'm going to do it again. You chose to go into healthcare, you chose to go into medicine. Because?
I grew up as a diabetic, and I understood what it was like to be a patient going through difficulty. And by the way, I didn't have anywhere near the social determinant problems, the life issues that people face every day.
Social determinants of your health.
Of health, yeah.
Go ahead.
I was fortunate enough to grow up in a suburban community. Both of my parents were physicians, and I still struggled with my diabetes. So what really made me want to go into medicine was my time in Baltimore when I was actually a counselor for newly diagnosed diabetes patients. And it was an inner city environment, and a lot of folks had difficulty. And I started to see that the folks that were impacted the most wasn't from their disease, it was from their social issues at home. So the lack of a home in some cases.
Poverty.
The poverty itself.
Hunger.
And so to not be able to address those issues is a big oversight, which is really what made me want to go not only into medicine, but into public health and healthcare more largely.
Well said. Dr. Shereef Elnahal, President and CEO of University Hospital, right here in Newark, New Jersey, just a few miles from where we're taping. Thank you for joining us, Doctor.
Thank you, Steve.
Got it. I'm Steve Adubato. We'll be right back right after this.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
I'm Steve Adubato. This is the 166th New Jersey Education Association Convention here in Atlantic City. We are joined by Ed Richardson. It says here, past executive director of the NJEA. First of all, Ed, it's great to see you.
You too, Steve.
We've had countless conversations over the years. I disclose this every other time.
Always good ones.
But I'll disclose this as well. The NJEA has been a big supporter, a major underwriter of what we do, and a supporter of NJTV News, our colleagues and partners. That being said, what's it like for you to look back on your, how many years?
26.
Oh, boy. You look back and what sticks in your mind?
Just that the quality of our public schools in the state has been a constant, and the commitment of our members to the children of the state has been a constant. And so whatever issues have come up over the years, whether it's school funding, student assessment, family involvement, it's always within that context. It's always within that framework. And so, it's so gratifying to be able to step away from the organization at a time when New Jersey's been ranked #1 for the quality of our public schools in the country by Education Week. When we have a level of member engagement and member voice and empowerment within our organization that is virtually unprecedented, or at least in modern times. And that we are focusing on the power of the diversity of our students and our membership in the state.
Why does that matter so much, the last part?
New Jersey's public school students are now a majority children of color. And our educators, our education workforce is not nearly close to that. And so we believe that it's important that as we move forward that children of color see themselves more in their role models, but also that children who look like you and I see role models who don't look like them. And we are very focused on that as a mission at NJEA, and I'm very proud that that is a legacy that I know will continue after I leave.
It's interesting you said that, because this year, social justice, I don't want to say race relations, but in part it's about race. And Cornel West, Dr. Cornel West will be joining us in just a little bit for an in-depth conversation, a major keynote address, right?
Yeah.
No accident that you're heavily into these areas.
Absolutely. You look at the logo for our conference, and it talks about student success.
That's right.
Social justice and education justice.
Education justice.
So we have the #1 schools in the state. We can't honestly say that the quality of education is universal across the state of New Jersey. We also have, even though in the aggregate, the most diverse state, perhaps in the nation, very segregated public schools, very segregated communities. And if we're not helping our children to be comfortable working with people from all different backgrounds, that does not bode well for our society, because as adults, we all have to do that. We all should do that.
But is that the role of the NJEA?
It's the role of public education in one sense. And yes, and NJEA is a huge force for public education in New Jersey. It's no accident that the #1 public schools in the state exist in a state with what I believe is the most powerful education union
So you
in the
correlate
state.
the two.
Absolutely. And if you look across the country at the other high-performing states, they are all strong union states. Why? Because those organizations not only advocate for the people who pay us dues, we advocate for the institution of public education.
You know, Ed, one of the topics, Ed and I have had a lot of on-air and offline conversations about a range of issues, but let's put this out there. You've been with the organization 26 years. You've been involved in a lot of battles, challenges, difficult situations, different administrations out of the State House. Governor Murphy literally just walked by us before, and I know it's a big deal to have him here at the convention. You've had a good relationship with him.
Very good.
You did not have a particularly good relationship with the previous governor, Christie. As a student of leadership, you and I have talked about this a lot. Do you take anything away from those 8 years and say, you know what? This is a lesson about leadership, about life, negotiation. Pick whatever you want to describe that we learned from that experience. Because it was acrimonious, to say the best.
Yes.
Go ahead, to say the least. I'm sorry.
So, and it's funny that you say that, because, looking back on one of the things that I'm proud that we were able to bring forward is we just got approved as a provider for instruction for educators to earn a new teacher leader credential.
I heard about this.
The law that authorized that to take place was passed and signed by Governor Christie. So even in an environment where there, yes, were certainly at times acrimonious
on certain
relations.
issues, pension issues, healthcare, so
right. You've always got to find, where is the common ground? Where can we do things where there will be support, because it's the right thing to do, because there's no way you can say that creating a credential for educators to help other educators is a bad thing.
Yeah, why would one be against it?
Exactly. So even in an environment where, no, we never had a good relationship with Governor Christie, I would say we didn't really even have a relationship, but in that environment, you do have to find where can you make progress, where can you find common ground, where could we build relationships within the Department of Education and the State Board of Education, which again we did during that time. So that's part of leadership, is finding wherever there is common ground, even if it's limited common ground.
Even if people can't see it on the surface. Let me ask you this real quick. I asked Marie Bliston, the president, about this, the standardized test situation. You can give me an update on that, your sense of it, because the NJEA has been very involved in the PARCC test. Is that going to exist any longer?
Eventually it won't. Right now, the assessment protocol that's been just recently adopted by the State Board of Education will dramatically kind of scale back the footprint of statewide standardized testing in the state. There is, on the other side of that, a federal requirement that has to be met, so that's been addressed.
With the National Department of Education?
Yes.
So it's the state and the feds?
It is, yeah. So there, so the federal requirements are that we administer a standardized test in the elementary grades 3 through 8 and at least once in high school. They do not mandate that those results be used for high-stakes outcomes in any way, either for students or educators. And a lot of research is pointing to the fact that that's a good thing because, let's face it, a student's life cannot be captured on a 40 or a 90-minute assessment. Yes, it's a good measure of kind of where they are. It's a good benchmarking tool. And that's how assessment should be used. It should be a powerful tool in the hands of educators.
Not the tool.
But not the tool.
Ed, listen, I know we'll continue to have conversations about education, about teachers, about students who matter most to them, but I've said this to you before, I'll say it again. Thank you to all the public school educators who have taught our children for so many years. They make a difference every day, and we thank you for joining us.
They sure do.
And having us here every year.
And it has been my pleasure for 26 years to work for them.
Thank you, Ed. Well done. We'll be right back right after this.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
She's back by popular demand. She's Heather Howard, former state commissioner of health in New Jersey and also a lecturer at Princeton University's Woodrow Wilson School of Public and International Affairs. Good to see you, Heather.
Thanks, Steve.
You're the smartest person I know on healthcare, which is a setup for the question. Okay, presidential thing going on. Okay, we don't know what's going to happen. But I do know this, Medicare for All is being talked about a lot. What is it? What the heck does it cost?
Well, numbers as high as it should. So everybody's talking about Medicare for All, which maybe isn't the right question to be talking about.
What is the right question?
I think we ought to be talking about costs, because everybody in America is struggling with healthcare costs. Nobody thinks that we're getting the value we should be for what we're paying for in healthcare.
Okay, so if Elizabeth Warren says, hey, Medicare for All, just tax people who are the wealthiest, will not affect the middle class. When you hear that, is there a part of it that goes, really?
Well, there's two issues. One, it's easier said than done, right?
Go
We
ahead.
can talk about.
Or it would have been done.
Can you imagine, the concern I have is we haven't thought through the potential disruption, right? It means half of the country has health insurance through their employer.
Yeah, what about if I have my private?
You would be transitioned onto a Medicare plan.
Would I be forced?
Yes, within a number of years, yes.
Is that why some say, how about Medicare for those who want it?
Right, so some people say, well, how about Medicare for All for those who want to buy in? I think it all boils down to, do you think our current system's working and we should just maybe patch it up where it's not, or should we tear it down and start again?
And you say, as an expert on the subject?
Well, I think history has taught us that we get further when we build on what we have and we move incrementally. I don't know that there's a public appetite to throw everything out. And is there going to be a majority in the Senate to do so?
You mean a majority
of people who would support throwing the current system out?
What is the president appears to say, President Trump, as we speak, appears to say, let's throw the whole thing out. Let's throw the Affordable Care Act out. Obamacare, throw it out. Do you think he understands what that would mean?
I don't think he's appreciating how disruptive that would be and how that how politically disruptive that would be for him. I think he sort of gets it when he says, we'll do it after I'm reelected. Well, what does that say? Then that means, right, I don't want to do anything between now and then, is a recognition that this would cause a lot of people a lot of pain if they have to change what they're doing. Yeah.
So interesting. The whole question of the Affordable Care Act, you and I were talking right before we got on the air. I don't want to confuse things, but part of the reason we do this program is to try to break things down and explain it. And that's why we always love having Heather here, because she can talk in very practical terms. There is a federal healthcare exchange. There is a state healthcare exchange. Consumers, people watching right now, can they go on either one of those? Healthcare.gov, go on, that's the federal site. It wasn't working for a while in the beginning. Now it does. Can you go on either one and sign up for insurance?
Yes, you can go to healthcare.gov. We're in open enrollment now.
Okay.
So
as we do this program in the middle of November, but go ahead.
Yeah, so they can go on healthcare.gov. Now, but you're right, the Affordable Care Act lets states operate their own exchange if they want to. And
why?
Well, because the theory was that states have different perspectives. The healthcare markets are very local.
So let's have more competition? Is that what the argument was?
That California can do it in a way that meets California's needs better, and Governor Murphy thinks that New Jersey can do it differently. And so he, at this time next year, will be opening a New Jersey marketplace. He's saying, look, I don't want the federal marketplace. I want New Jersey to own this because I think we can do it better.
Does that make sense?
I think it does, because we're now paying more, given the size of the state, we're paying the feds more to do it for us. And we can do it better with that money. Keep it here in New Jersey, do more advertising, target it to populations here.
Excuse me for interrupting. By the way, if you're listening on the audio side, Heather Howard, former Commissioner of Health in the state of New Jersey and also a lecturer at Princeton University on these subjects. Fair to say that the federal government cut back on the dollar. You could say advertising. Advertising, particularly for those of us in the media, is a euphemism for public awareness. They're like, listen, we can't do away with the Affordable Care Act, Obamacare. I'm not going to spend a whole lot and let people know about it.
That's right. So you have a president now entrusted with implementing a law he doesn't support.
Yes.
And so some people call it sabotage. He said, I'm not going to fund outreach. I'm not going to advertise the Affordable Care Act. And what's the risk of that? Is that means fewer people are signing up. And it's particularly risky because sick people will sign up for health insurance because they know they need it. But we need healthy people to sign up for health insurance,
Explain to
too.
people why it's not just younger, healthier people, but they happen to usually be healthier. Why do we need healthier people on, and what does that have to do with insurance rates?
Well, because basically, insurance is about spreading risk.
It's a big pool.
That's right. It's about spreading risk, and you want as many people in there sharing the costs so that when somebody gets really sick, there's enough money to pay for those costs. If only sick people buy health insurance, there's not enough money in the system, or you have to charge really high premiums. If a broad swath of people are buying health insurance, and especially healthy people, and arguably not using it, then that means there's enough money in the pool.
So Heather Howard, why is the number of uninsured people in New Jersey rising?
Well, I think partly because there's been this sabotage from the federal level. They said, we're not going to advertise, and that's partly what Governor Murphy's responding to. He's saying, okay, I'm going to take back control, so we will advertise it. We will let people know when open enrollment is. We will make sure they know what plans are available. And so that's the tension here.
You know, you and I have had this conversation many times, and I'm going to put it this way in the time we have left. If someone says, hey, let's just fix the healthcare problem. You laugh when I say that.
Yeah.
There isn't a fix.
There's not a fix. I like to think in 1948, Harry Truman tried to do universal health care. At that time, health care was 4% of our GDP. Now it's 18%.
4% to 18.
Of our GDP.
Am I wrong that Richard Nixon actually tried to do something?
He did too.
And actually pretty progressive stuff.
Ted Kennedy used to say that one of his biggest regrets was that he didn't cut a deal with Nixon. We could have gotten universal health care with Nixon.
Wow.
And it wasn't good enough at the time, but it would have been better than where we are now.
Then Hillary Clinton, when she was first lady, and then all these iterations.
So finally, Obama makes significant progress, but we're backsliding now and losing ground. And I really think once it's 18% of the GDP, how do you reorganize a fifth of the economy?
I don't know, but we're going to keep asking Heather Howard. Thank you, Heather.
Thanks.
Stay right there. I'm Steve Adubato. This has been State of Affairs. Thanks for watching. I'm out of breath. We'll see you next week.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by PSC&G, the law firm of Gibbons PC, MD Advantage Insurance Company of New Jersey, Wells Fargo, Johnson & Johnson, NJM Insurance Group, Community Food Bank of New Jersey, Fedway Associates, and by ADP. Promotional support provided by NJ Advance Media and by Tap Into TV.
PSE&G is building New Jersey's clean energy future. We're working to protect our network against extreme weather, expanding and upgrading transmission lines, and modernizing our natural gas system by installing new, more durable underground pipes. At PSE&G, our goal is to make sure you have the safe, reliable energy you need to power your life now and into the future.